A stands for not or absent. Myo refers to the muscle cells. Trophic refers to nourishment. And lateral sclerosis refers to the hardness or palpations of the lateral columns of the spinal cord. ALS is a neurodegenerative disease characterized by progressive muscular paralysis, reflecting degeneration of motor neurons in the primary motor cortex, corticospinal tracts, brainstem, and spinal cord. This disease impacts voluntary muscle movements. However, the individual's intellect typically remains intact throughout the progression of the disease. It creates muscle weakness and atrophy throughout the body, caused by the degeneration of the upper and lower motor neurons. Upper motor neuron signs include hyperplexia, stiff muscles, spasticity, extensor plantar response, which is when the foot goes up, and positive jaw jerk. Lower motor neuron signs include weakness, muscle atrophy, cramps, and fasciculations. Additional characteristics in all cases of ALS include difficulty speaking, swallowing, and breathing. Early symptoms rapidly lead to progressive paralysis. In 50% of cases, death occurs within 3 years of diagnosis, and 4% of individuals can survive 10 years or longer. ALS is the most common motor neuron disease. 1 to 2 out of every 100,000 individuals develop ALS each year.
The earliest symptoms of ALS are typically obvious weakness, muscle atrophy, twitching, cramping, or stiffness of the affected muscle. Individuals affected by this disorder may ultimately lose the ability to initiate and control all voluntary movement, although the bladder, bowel, and muscles responsible for eye movement are not always but usually spared until the terminal stages. There are 2 different types of ALS, limb onset and bulbar onset. Limb onset is characterized by focal muscle weakness in either the upper limbs, which is known as cervical onset, or the lower limbs, which is known as lumbar onset. Limb onset is typically asymmetrical and tends to affect both gait and dexterity. Most individuals living with limb onset will progress to bulbar onset symptoms and experience respiratory failure within 3 to 5 years of being diagnosed. 75% of individuals contracting this disease will experience limb onset with their first symptoms occurring in the arms or legs. Symptoms of limb onset ALS include awkwardness with walking or running, tripping or stumbling, and often individuals may drag their foot gently along the ground while walking. The next type of ALS is bulbar onset, which typically occurs in women or older adults. Initial onset symptoms lead to slurred speech, wasting of the tongue, difficulty closing lips, or difficulty swallowing and excessive drooling. Limb weakening symptoms typically occur 1 to 2 years after initial onset. Respiratory failure occurs within 2 to 3 years and is slightly quicker than limb onset. 25% of individuals will experience bulbar onset ALS.
The cause of ALS is still unknown. Most cases are sporadic. However, 5 to 10% of cases are familial. 20% of these familial cases have a common gene mutation on the SOD1 gene, which is located on chromosome 21. The normal SOD1 gene produces the enzyme superoxide dismutase, which helps break down potentially harmful oxygen molecules and cells. This helps prevent damage to muscle tissue. When a mutation is present on the SOD1 gene, this leads to the destruction of neurons around the spinal cord, which controls muscle movement. Mutations in this protein lead to organisms developing progressive motor neuron degeneration, which leads to ALS. Another important factor in the cause of ALS is the role of glutamate. Glutamate is a neurotransmitter in the brain and has recently been shown to play a role in motor neuron degeneration. Individuals with ALS have been shown to have higher levels of glutamate in the serum and spinal fluid.
Sporadic ALS typically affects individuals around the mean age of 60. Males have a slightly higher chance of being diagnosed with ALS with a ratio of 1.5 to 1. ALS is also present in younger individuals and is known as juvenile onset. This type of ALS progresses significantly slower than adults who are diagnosed with ALS. Limb onset is more prevalent than bulbar onset. 2/3 of individuals who are diagnosed with ALS will have limb onset.
Symptoms and progression vary greatly between individuals. However, the final progression is similar for all, which includes severe difficulty walking, inability to get out of bed, and inability to use arms and legs. Individuals on average live 3 to 5 years after first signs of symptoms. Roughly 4% of individuals will live longer than 10 years. The late stages of ALS are characterized by restlessness, anxiety, pains, and a high amount of care. Individuals experience significant difficulty with swallowing and chewing, which makes it more easy for the individual to choke and aspire food in the lungs. The diaphragm becomes weakened, resulting in difficulty breathing and using respiratory muscles. Most individuals pass away due to respiratory failure, which is usually 3 to 5 years after the onset of symptoms.
In order to be diagnosed with ALS, you must have both limb and bulbar onset symptoms. Diagnosis is often difficult due to the fact that all individuals experience different manifestations of the disease. Quite often, the symptoms of ALS mimic other disorders or diseases, which then can lead to incorrect or delayed diagnosis. Nerve conduction studies are used to help test for ALS. These studies allow the physician to exclude all disorders that will mimic ALS symptoms. Another method used to diagnose ALS is electromyography. This is useful for identifying lower motor neuron loss. This test shows findings that will include fibrillation potentials, positive sharp waves, and chronic neurogenic changes, which can help with early detection of lower motor neuron involvement. Neuroimaging, such as an MRI, can lead to the ruling out of other diseases. The use of neuroimaging has confirmed that ALS is a multi-system cerebral neurodegenerative disorder.
Due to the fact that there is no cure for ALS, the different types of drugs and treatments are used to help to sustain life for individuals. Care for individuals with ALS is primarily supportive. This means it will not lead to an increase in functioning, but can improve their overall quality of life. Artificial ventilation is used as an external survival method. This is used when respiratory muscles become targeted by the disease. Different medications can be prescribed to people with ALS to help reduce fatigue, control muscle spasticity, ease muscle cramping, and help reduce phlegm and saliva. Riluzole is a drug that is used to inhibit glutamate transportation and release. It has been most beneficial for individuals with moderate functional impairment. This drug inhibits glutamate release from presynaptic terminals and increases extracellular glutamate uptake. In the late stages of ALS, individuals may be put into palliative care, where nurses and caregivers can help families with the medical, emotional, and financial challenges of coping with an individual with ALS. There is still a lot to be learned about ALS. The disease remains incurable and the cause is unknown. Thus, further research needs to be done.
The final progression of ALS leads to an absence of motor control. Muscle spasticity can cause a decrease in balance, stability, and gait, which can impact an individual's quality of life. ALS impacts both fine and gross motor skills, leaving an individual with little to no control over these movements. Tasks of daily living, such as using a key to open a door, using utensils to eat, and writing all become very difficult for the individual. During later stages of life, the individual will have difficulty trying to administer movements for gait and posture. Once connections have been lost, they cannot be reestablished. Since the end result of this disease is complete immobilization and paralysis, the individual's motor control is significantly affected.